So my name is Kara Welke. I'm an occupational therapist for going on 26 years. Started my own private practice in 2018. When we first started, I started 100% mobile, focused on older adults. We now have a clinic location, and we do women's, men's health, pediatric health, adults in general, as well as older adults. And then we contract with quite a few different organizations, a home health company, skilled nursing facility, senior center, memory care facility, also a 55 plus community. And yeah, we're working with quite a few different companies on some other projects in place, such as RKM, RTM, and things like that. So managed to keep busy, started Next Level Occupational Therapy in 2019. And I met Steve in 2018, and then in 2019, Steve and I joined forces, and we started to help therapists start and build their own private practices. So we've helped hundreds and hundreds of therapists since then start, build, and grow their own private practices. So a little bit about me. Steve, you want to introduce yourself?
Sure, thank you, Kara. So my name is Steve Glukh. I am an occupational therapist. I've been practicing, or I graduated in 2013, and I went through a whole bunch of different populations, so pediatrics, outpatient, ortho, skilled nursing facilities, assisted livings, home care, mobile Part B, all of that. And I was fortunate enough to meet Kara in 2018, and HelloNote was growing. We started HelloNote around 2016, and it was meant to be a solution for our own practices because there wasn't a platform out there that was affordable, that was all in one, and that really had a feeling from a therapist perspective. So we built everything from the ground up, and we've been growing ever since. So now we cater to OTs, PTs, and speech. And we also actually do have custom templates now, so we're getting a little bit of chiros, massage therapists, acupuncturists, athletic trainers as well. So it's nice to help the industry, but primarily we do focus on the OTPT and speech space. So over the years, Karen and I have worked together to get as many private practice owners out there. Even if you don't know anything about private practice, this is where Kara's program comes in, and that's where the education and all the knowledge is, where you want to soak everything in and then make your decisions. But Kara's program, Next Level Business Builder, is not just a course where, you're just part of a course and that's it, and then you're left to dry. It's actually a step-by-step guide and the whole networking opportunity where you have essentially a mentor, and your hand is being held up until, whenever you want. Even clients that have successful practices we work with because there's more room to grow. So we're excited to do this presentation because we do want more and more private practice owners out there.
Yes. And I just met with AOTA today, and talking about a new model that is going to be the NOFO is going to be coming out the first part of the year. And it's going to be an awesome program that fits well for therapy professionals that can provide added revenue for doing wellness-based programming for older adults. So lots of different options out there as we entering in 2026. Here we're going to see there's quite a few different models that CMS is actually putting out. So lots of options for you guys. Okay, so I will tell you that I might turn off my video. Kylie, let me know if I need to turn off my video where we go. We've been in a blizzard here, and so our Wi-Fi connection has been a little shaky. So if you can't hear me, I'll stop and kind of repeat myself, but just a heads up on that. And then let's see, we should be good to go. Okay, so starting a practice in 2026. So today's objectives, first of all, is determining whether initiating a private practice in 2026 is appropriate for your current professional role, personal circumstance, as well as risk tolerance. We're going to analyze the different healthcare system factors, including regulatory requirements, reimbursement pressures, and operational complexities that affect the ability to start, build, grow a private practice. We're going to evaluate the implications of licensure, payer rules, compliance standards, and business structure decisions, and then hopefully give you a roadmap that you can use if you do decide to go this route, or if you have a practice, you can help improve your current practice. And we'll talk about how you can prioritize foundational, operational, and growth-related actions. So the first thing we want you to do, so we're pretty excited about this, and we would love your feedback. So we've been working on a private practice quiz, and if you take the quiz, based off what you score, or based off how you answer it, you're automatically gonna get a score. Now, we haven't done any research on this, so yes, it might not be 100% accurate, but we hope to start trying it out more. Everyone who's tried it so far feels like it's pretty accurate. So we'll just take a couple minutes here. If you can scan the QR code, take the quiz. If you want to share your results in the chat, feel free. But if you don't want to share the results, maybe you disagree with the results, you don't want to share them, you don't have to. So we'll just take a couple minutes for you guys to do that. I should say, can you put yes or no if you're able to get it pulled up? I just want to make sure it works. Awesome.
Pulling it up as well. Let's see. Yep.
And
it works.
For those of you guys that have a private practice, and if you take the quiz, you can let us know what your thoughts are if you feel like it's accurate as well. So we're pretty excited about that. So again, why we do this, before we even meet with, or when we meet with practice owners, because our program isn't the fit for everyone, right? So in fact, we do a lot of just one-on-one consultation or one-offs, because not everyone wants a program, needs a program. Sometimes we just, do private consulting. But one thing is we do find that some people get into starting a business and then realize it's not for them. So we're trying to implement more and more that we can do as much education up front and make sure that people know what they're getting into, and this is the path that they want to choose. I always share this story, so I'm sure you've heard it a million times. Everyone, he'd rather chew off his left arm than start a private practice, and he insists that he's going to come and find me after I pass away if I leave him with my two practices or my two businesses in place, because he wants nothing to do with starting a private practice. So let us know what you think. If you don't want to share your results, you can even just share accurate, not accurate, so forth in the section.
You also might want to say,
Kara,
you did cut off at the beginning of that. Your husband does not want a business. They're probably wondering who wants to chew their arm off.
Oh, dang it. See, I told you. Maybe I'll turn off. I hate not sharing my video, but I'm going to turn it off just in case it helps. Yes, my husband is who I was giving an example of that would definitely not do well with the private practice. Okay, the other thing I want you guys to think about is, do you want to create a job for yourself where you're self-employed, or do you want to be a business owner? And we actually work with therapists on both sides. We have some therapists that they literally just want to be self-employed. They want nothing to do with hiring staff, growing, scaling a practice. And then on the other hand, we have therapists that want to get to that point where they're a business owner. They want to be the CEO, where they're not the ones working in the business. And put yes or no in the chat if you guys are familiar with Robert Kiyosaki's cash flow quadrant. Anyone familiar with that? Yes or no? If you're not, it's a good book, good read. I mean, he has videos, YouTube, book to check out. So this is a version based off of his cash flow quadrant, and we reformatted it for therapy practices. So on the upper left side, we got the therapist working for someone else, so your standard employees. So all of us, when we got out of school, not all of us, but many of us, when we got out of school, they taught us how to do job interviews, submit applications, write our resumes, and we go work for someone else and we're considered an employee. Some people get tired of working for themselves and they actually become self-employed. So that's the bottom left quadrant. And so those therapists, they like to be their own boss. They value their independence, but really they've just created a job for themselves, not a true business. Those that want to actually become a business owner need to jump over to the right-hand upper quadrant. And that's when you really gain the freedom, when you can leave the business for long duration and it still runs profitably. You have the right people on the bus. You're not the therapist doing the work. You have other therapists working for you. And then the bottom right quadrant is now you make money with money that you've made from your business. So those are the 4 different quadrants. Based off of what we talked about, are you guys more interested in, just being self-employed, working for yourself, not really hiring, adding on other staff, or do you guys want to create your own business? What side of the quadrant do you guys feel you want? And go ahead and share that in the chat. Self-employed. And again, no side is wrong, right? I mean, everyone has different goals, visions with what they want to do. So, okay, great. We kind of have a mix with that. I like this quote. The E-Myth. I don't know if any of you guys have read that. Another good book. But I like this quote. If your business depends on you, you don't own a business, you have a job. And it's the worst job in the world because you're working for a lunatic. That one kind of cracks me up. Okay, so let's get started. Reasons to start a practice in 2026. We always like to start with asking you guys, what is your reason to start a practice? Why do you guys want to start your own practice? Anyone want to share?
Ara, why don't we say why we wanted to start a practice?
Perfect. Yes, we definitely can. Holistic care for peds and better work environment for therapists, control of patient care, be able to focus on the work that is my passion versus being directed by others. Awesome. Why did you, Steve? What was your reason?
So my reason was, well, I had my father who was an entrepreneur, so I was exposed to that early on. I mean, again, it wasn't just all fun and games all the time. So, I had to know what it's like to sacrifice a lot. But the plan was for me to add occupational therapy to his physical therapy practice, but it wasn't. Sorry, hold on, guys. My daughter ran into the room. I guess she wants to say. Uh,
For me, it was all about the
sorry, I'm
time
back.
flexibility. Okay, good. Keep going.
Yeah, so yeah, I mean, that was the plan. But I've had businesses before, like website businesses and things like that, more on the tech side. That's where Hello Note came along. But honestly, it's the having the financial freedom and freedom of time as the goal to wanting to start a practice. Because when you can make your own decisions and not work for somebody that dictates how you should treat or how you should work. It makes a big difference on your mindset, and that allows you to hire employees and treat them how you would want to be treated. So that was my motivation to start a business.
Awesome. I want to share, Heidi said, among other reasons to satisfy a community need. Again, another reason of mine. Create a fair and happy work environment for excellent OTs, create more time flexibility for herself. I think this is Daniel, have more control of creating a caseload, not depending on the system to provide me with clients with a system that doesn't value OT, offering the services that I want to provide, not having so many bosses, not feeling like I'm trapped, putting in extra work. All excellent reasons. And then I miss freedom and flexibility with time and patient care. Yeah, all of these reasons are mixed into what, for me too. I just really wanted that time flexibility, so I never missed any of my kids' events. And then I was tired with the poor quality of care being provided, and I knew if I did it myself, I could provide therapy the way that I knew it should be provided. So yeah, there's lots of reasons, but we'll talk about a lot of when we're working with staff or when we're working with therapists, we always talk about their reasons, and then also with the way things are going. We've put together other reasons why people consider to start a private practice. So again, the autonomy over your time, schedule, and energy. So there's nothing better than being able to design your own schedule that allows you to be able to do what you want. When you want it. I always say initially I thought I would get more time freedom, and it's definitely not more time freedom, but the time flexibility has been huge. And like Heidi mentioned, that's the other thing that I love to provide to the therapist that we hire. They don't have to go to an 8 to 5 job. They are able to schedule their day the way they want, schedule the clients when they want. If they want to run over to their kids' school at 10 o'clock in the morning, they can run over to their kids' school at 10 o'clock in the morning. So all of our therapists are also able to design a schedule that aligns with their lifestyle. And I just think more and more the ability to do that is huge because people want that. And then reduce burnout, right? I mean, having to go and do the same thing over and over. I don't know how many of you guys got tired of showing up at work and you had your list of clients and you were told you have to see this one for 15 minutes, this one for 25 minutes. To that because I did what the patient needed. But when you work for yourself, you're the one that designs how things need to be run as well. So, you really decide when and how you work. Steve, anything you want to add on this side?
No, it's definitely everything combines because autonomy is really important, right? And schedule, your time, your energy, all that goes into running a business, and it's your mindset, honestly. And that's what I learned even speaking to different coaches over the years and mentors and all this. So it's all about your mindset. And the goal is to integrate everything together instead of reacting to all the negatives, right? So how you position yourself is important because it's also important to adapt when it comes to running a practice.
And then, like some of you said, the ability to design care that actually works. So you're able to customize services to meet the real needs of clients and your community. So again, today that my therapy manager and I met with a company that has this awesome, like amazing virtual reality system. And we're working with them on bringing that into our practice. When you work for someone else, if you want to bring something in, you have to go to one person, then they have to go to the other. And the likelihood of you being able to get it in is often a struggle versus when you work for yourself, you can do whatever you want. As long as it's legal, right? So you can adapt quickly. You can create innovative programs. We work with a variety of different agencies, providers, and do a variety of different programs. And then you can adjust your offering. You can grow and change as client needs, regulations and markets evolve. And so overall, your care is driven by outcomes and impact, not organizational constraints. And then freedom to choose who and how you serve. So this goes kind of along with, the one before. But when a lot of our practice owners really niche down, so we have some therapists that only do lymphedema, we have some that only do dementia, we have some that only do home mods. You don't have to be, some places you have to work in acute, and then you have to switch over to rehab, and you have to kind of do whatever is there. When you're working for yourself, you can make those decisions on who you want to see. And then, you move from employee to actually being the decision maker with that. And then even further from there is full control over business and clinical decisions. Now, sometimes this can be a difficult one, especially when you get to operations, staffing, and things like that. But overall, you're able to just create the services you want, implement changes when you see them, and work with really whoever you want to work with. Steve, any additions on any of those that we covered?
Nope, I think that's good.
The other thing is building something meaningful and sustainable. We've had a lot of therapists. One I worked with today, actually, he started his mobile therapy practice, and he also collaborated and created fitness, like an adaptable fitness group for people with disabilities, and they do group classes and individual coaching and so forth. So that was kind of a side thing. And then they talk about they're going to create a nonprofit arm in order to help support that. So you can do a lot of other things. And then we like to work with students and help provide mentorship and, allow them to see what, for us, when we do OT, what true OT is really like in practice. And then really, you really build those deep connections with not only your clients, but also community members. If you do decide to build a practice, or you already have one, you already know this, but you really have to build good, solid relationships in your community and develop those partnerships, work with others in order to, build and grow. As far as financially, now again, this can be tough. Unfortunately, we see practices that come to us a little too late, and they've been up and going for years and still aren't paying themselves, which really isn't a business. But if you set your business up and build and grow it appropriately, it can be a great way to improve your financial situation. And having your own practice and being a business owner allows you to do, multiple different things. And just like I said, we really recommend diversifying your revenue stream. So we're not just focused on insurance or cash or contracts. We work with a variety of different groups. And then tax strategy. This is one thing we've been really pushing over the last 4 months, is working on tax strategy and how business owners can work smarter, not harder, and work with tax strategists, definitely not me, but work with tax strategists to make sure they're making the most out of their business and keeping more for themselves and their business. So those are some of the major reasons people start their practice. And we want to go over some kind of reality check points for what you need to think about when you're starting a healthcare practice. Regulatory and compliance complexity. I would say, and Steve, you can let me know what you say, but this is probably one thing that practices gloss over and don't pay attention to. And the amount of fraud and things that are going on continue to increase and increase. I mean, we had 2 therapists in 2 days contact us due to fraud, one with an employee, one with a business contract. We see several businesses not understanding compliance, not having a compliance plan, policies, things like that. So I'd say this is one of the biggest things people miss out on. So with healthcare businesses, we operate under federal and state regulations. We are facing heightened compliance, audit, and documentation risk. There are legal billing and payer rules that change, and we have to keep up with it. Today, we just did an hour-and-a-half session preparing to close down 2025, prepare to start 2026, and then the new changes that take place in 2026. So there's always things to keep up to date on. But there's great resources out there to help you do it. And just, the reality is that a healthcare practice is more regulated than other small businesses. And ignorance to that is really expensive, even when it comes to liability, or not liability, to insurances. A lot of people think they just need to get professional liability, and they miss out on some of the more important insurances that can really save them when issues come up in a healthcare type practice. Steve, what are your thoughts? Do you think this is a major area or not?
It's definitely a major area, and as you said, I think a lot of practice owners skip over it. Also, because A, they don't understand it, and B, a lot of times they say, "I'll get to it," right? So I hear that a lot. So, but it is important. You need to know the foundation first, and you don't want to get in too deep before it's too late. And that goes into what you said earlier. Practices come for help too late, right? By that time, your foundation is already kind of built, and you're stuck in your ways. And if you have employees, they're stuck in their ways, and it's so hard to retrain. I was just talking to someone earlier today. Where they're setting up with doing their own billing, and they have a biller currently, and they've just been sending CPT codes and units to the biller on a Google sheet instead of doing notes. So I told him, you got to get out of that mindset. You have to start doing notes in the system, right? So, again, it's hard to retrain your habits, so you got to start early.
It was interesting. Actually, I was meeting with the director of AOTA policy and regulatory affairs today. And that was one thing she brought up, that they see some therapists with businesses like hire billers that don't always understand therapy billing and have gotten themselves into quite a bit of trouble. So really got to be cautious with that. But if you go back to the basics and take the time to learn and understand the rules and regulations we need to follow, right away, you're creating that foundation that is going to help you. And if you take the time to know and understand it, you're going to feel so much better when and if you offload that. Time, energy, and operation load. We see this quite a bit with therapists, especially with social media. They think that they're going to start and build a business and, be making what they made in their W-2 job in 3 months or 6 months. And, just remember that you're building a business that you hope to last. I would think you would hope to last for a long time. And some people's goals are even to create a good, solid business that they can sell. And it takes time. How many years does it take for a small business in general to make a profit? Anyone have any idea? Put in the chat how many years you think on average. And this is just in general, small businesses. Yeah, so 2 to 3 years to make a profit, but actually that 7 years is to get it where it's really functioning well in there. So, really knowing and understanding what you're up against, and that, businesses usually have an investment that they put into the business to build and grow. So there is an investment that you will need to think about when you're building or grow, and then plan it out so you know how you're going to support yourself while you're building this business up. Now, the great thing is many of the therapists we work, they start their business up on the side, so they're working, and then a lot of them start a mobile practice, which is really cost effective because they don't have to pay for a clinic space and things like that, and you don't need you don't even need really equipment because you can utilize the home environment, and that can allow them to get up and going. But we've had a few therapists that about 10, 12 months are frustrated. They don't have enough clients. They're really ready to give up. And, we're like, nope, this is, you can't give up. Let's keep on going. And then a few months later, they're full in, busy, ready to hire. So the timeline is going to be different for each of you. And it's really important that you don't compare yourself to someone else, because you're all on your different road and it's going to vary. And we've seen therapists 3 to 6 months get a pretty good clientele, and we've seen some that have tried for a year. I've had a few therapists reach out lately that they've been trying to start their business for over a year and they haven't even seen a client. Obviously we don't want that to be, but just understand that it does require time. And then the daily operations are way more than just patient care. There's the admin, the scheduling, the billing, the marketing, the follow-up that needs to occur during the process. And initially, it's also learning the rules, regulations, and things you need to do. So being able to implement systems and learn how to delegate sooner than later really makes a huge difference. Systems knowledge and gaps and resistance. How many of you know what a CRM is? Put yes or no in the chat. I had no idea what a CRM was until 3 years ago, and I started my practice in 2018. So, some people don't even know what a CRM is. EMRs, I'm guessing you all know what EMRs are. SOPs. Do you guys all know what a SOP is? Yes or no for SOPs? Awesome. Again, I probably didn't know what SOPs were until a couple years into my business, but customer relationship management, EMRs for documentation, standard operating procedures, creating automations is huge. Back in 2019, I joined like a massive mastermind group, and one thing they always talked about, systems and automations. That's what you need in your practice. But my frustration was, yeah, I need systems and automations, but how do I get them? What are they? And so forth. And I wasn't really a coach that would actually be a game changer for your practice. And I had worked with at least, what was it, Kylie? We had worked with at least 3 other companies before trying to get something in place. So knowing these tools and how they can actually save you time and money in the long run is going to be huge. Because practices, like it says in the reality, practices fail not from lack of passion, but from lack of infrastructure. And a lot of times it's because we just don't know. So implementing systems sooner than later is going to reduce stress and actually save you time and money in the long run. And, 50% of you won't agree, won't do it. Other 50% may implement it and it'll be great, and know how great it is. But, and just know that if you don't do it now, you're going to have to do it in the future, and it's a lot harder to do later. We implemented a CRM and systems and automations after I had a full staff, and it's really hard to get staff to buy into change and so forth. So, Steve, anything you want to add on the systems and knowledge, or the time and energy operation load?
Yeah, just want to say that have the systems work for you. right? And they should be a supplement to your business and to yourself. And they shouldn't be looked at as an additional tool that either you're paying for or more work to do. You have to make it work to your advantage.
Emotional and financial stressors. So before starting a business, when starting a business, and then throughout the business, you're going to be faced with emotional and financial stressors. I don't know I'm probably in the 500s now of how many times I've said that I need to burn down my business, or it's going to burn down, or it's going to shut down, or it's not going to make it. You go through that time of uncertainty, both emotionally and initially financially. Also, things happen. The most recent one in October, when the government shut down, some people were affected because they weren't getting money. So they faced a lot of financial uncertainty. So knowing and understanding that you are going to have ups and downs is really important. The more you can have a community, a support system, a mentor to help guide you is huge. I mean, I'd be lost without my mentor team, because who else do you talk to if something doesn't go well, or something is going on and you need some advice on what to do. So know you're going to have highs and lows, and then find a community group, mentor, someone to help you be able to adjust as you go through it. Owning a practice requires emotional regulation, not just clinical skill. Predictability comes from planning, metrics, and diversified income. So when the government shut down, we actually called like an emergency meeting for everyone in our therapy business builder program. And one of the first things one of the therapists said, they're like, Kara, this is why you stress that we have 3 months of reserves, isn't it? And I'm like, one of the reasons why. Also, we talked about diversifying income. We don't want all of your money coming from Medicare. We want to have multiple sources of it to come in. So you're going to have it. Prepare before you start, and plan or figure out who's going to be your support system to help guide you through it. And initially, with the financial stressors, you need to be smart on finances. That's one thing where we've seen a lot of people have to shut down because they didn't know what to do with the money they made. They were so excited with making the money, they just paid themselves. They didn't set aside money to help grow the business. They didn't set aside money for stressors, for taxes, or they paid staff too much. So there's a lot of things you need to know on the financial side of things. And then there's also external forces that you can't ignore. So there's ongoing changes in healthcare policy and reimbursement. I mean, we're constantly keeping up to date on this. Things are changing. Like, the telehealth was a huge one. We have tons of therapists that work with health. Got shut down, it created a huge problem for people. But it's knowing what's going to happen and making sure you have a plan B. Telehealth might not continue after January 31st. So we need to have a plan in place if it doesn't get continued. So being able to keep up in that. Employment and labor markets, this is another one of the toughest things that is impacting therapy practices now. They can't find therapists. If they do find therapists, they want to get paid way more than what we even make from insurance. So that's really difficult. Some of our therapists struggle with technology and automation. Some of the different features takes time to learn, and it's difficult. Social media and digital visibility, always changes with that. Personal factors, things we see. A lot of people don't start a private practice or put it off because they're worried about health insurance access. I was just on a call today with someone that has started a private practice, but she's expecting and she needs to kind of shift when she's going to actually open the doors. So our family needs change, and then also risk tolerance. So the healthcare landscape is going to continue to change. So it's just really important that you build systems and be able to have ways to adapt and pivot, because you don't want to be reactive with it. Steve, anything to add on either of those?
Nope, what you said is good. It's better to have a way that you adapt. It's better not to be reactive. So I agree with that.
So what it all comes down to is business literacy alongside clinical expertise, systems that support, not overwhelm you, clear boundaries, policies, and priorities, and willingness to prepare for uncertainty instead of avoiding it. The risk isn't starting a practice, the risk is starting one without a proper foundation in place. A few things that we want to cover that you need to think about when starting a private practice. We're really seeing a big push for people trying to get around Medicare, just wanting to do cash, not wanting to call themselves therapists anymore. There's a lot of different things that you need to consider when you're starting a healthcare business and when you are a licensed therapist. Out of curiosity, I know you guys have shared in the beginning, but what type of model do you guys want? 100% cash, hybrid, 100% insurance, contract? Have no idea. What kind of payment model are you guys looking at having? Okay, we got a hybrid, not sure. Not sure, at least Medicare and cash. And if you don't really understand all of the different business models that are out there, and you don't know what kind of model would be best for the type of practice you want, we actually have a webinar that we did. It's on our YouTube channel that talks about the different models of practice, and then based off of what kind of practice you want, what kind of model you need as far as payment. So might be a good one that you guys want to check out. Heidi says, currently take most insurances, interested in hybrid model in second location. Awesome. When I started, I will tell you, I wanted to be cash because that was back in the day when all of the cool PT people out there that were starting a practice were starting cash-based private practices. So that's what I was going to do. Getting everything up and going, and then realized that I couldn't do that with the population I wanted to serve. Okay, so we already talked about the emotional and financial stressors. We're going to talk a little bit more about healthcare businesses being regulated by different payers and different layers. So there's state rules and regulations. So when we're rules and regulations, national and federal regulations, payer and insurance rules, as well as professional compliance standards. So one of the big things to think about is, if you're providing a service to older adults that's skilled and medically necessary, OT and PT at this time cannot opt out. They are trying to get that changed, but at this time they cannot opt out. There's a mandatory claim submission, and we have presentations that we go into great detail about the Medicare regulations and so forth. But if you're working with older adults, it really isn't going to be the best model to try to do cash, because you really can't do cash for services that are skilled and medically necessary. So just things like that you need to keep in mind. Also, for instance, if you take payment from Medicare and Medicaid, you need to make sure you're meeting the 1557 regulations that are in place. The Office of Inspector General has compliance plan standards, requirements that you need to have in place. So depending on what you're doing as a healthcare business, we are regulated differently than small businesses, and mistakes can really compound quickly and cause a lot of problems. Also, there's just, even if we've had practices that want to just do like private caregiving, and they get themselves into trouble because they don't realize that in order to do private caregiving, you actually have to be licensed. And not all states, but in a lot of states, you have to be licensed, and there's a big process that you need to go through. So different things to think about based on what kind of practice. Also, state by state differences. So never rely on someone's instructions that live in another state, because the requirements in one state could be different in your state. Okay. So really important, because we see it all the time on social media. Someone asks, what do I need to set up for my business? What kind of, or, do I need to hire an employee or as an independent contractor? Or there's just a variety of different circumstances. Medicaid. What does Medicaid pay? Again, a lot of these things are going to be different in one state during the other. So learn the rules and regulations for your state. Same thing with insurance. I see this a lot of times where people are looking for information about insurances. Well, Blue Cross is going to pay different in North Dakota than it does in Arizona. There's just a lot of differences that you need to keep in mind with all of those different areas. So not all states are the same. Very important to know and understand so you're compliant in your state. And then small setup decisions can create long-term problems. This year, I swear we've seen it all. One of a big one that created multiple months of difficulties is therapists that actually hired help from an accountant to set up their business, and ended up making some mistakes that impacted them with like credentialing. And they ended up having to start all over again. And then they ended up having multiple EINs, multiple MPIs, which then caused trouble down the line when they were doing credentialing. We had another group actually go to a healthcare attorney, and they ended up setting things up incorrectly because they didn't know and understand therapy rules and regulations. So just make sure when you're setting up your business, to utilize people that know and understand therapy practices. And, it's really important. Like, a small thing is, when you're starting your business, keep punctuation out of it. Don't use commas, hyphens, or whatever, because that can lead to some issues. Your name needs to be the same. We apply for your EIN, we apply for your bank account, and so forth. Just little things like that are important. Ooh, also, when you're getting your EIN, we've had people get scammed, because you can go and apply for your EIN for free. But if you go on the internet, there's all these people that will pay you to do it. And yeah, there's so many different things out there that you need to be careful about. Steve, any examples that you want to share on the last two screens?
Yeah, especially on the EIN one. You know how many people I spoke to that paid hundreds of dollars to get an EIN and again, if you Google it, it's going to give you top promoted links. When you see promoted or sponsored, don't click on those, right? You want to click on the organic ones, and the number one organic one is actually from the IRS. But yes, it's very important to actually go to those who know what they're doing. And sometimes you'll get someone that will sell you on a good price, and they're gonna open up a company and whatever it is for you, but they actually set up the wrong company. How many times did we have somebody open up the wrong company? Because different states, as you said in the prior screen, different states, different regulations, right? So in one state, you have to have a PC, in another, it's an Inc. or a Corp, whatever it is. So it is very important to go with and vet somebody, and listen to others and get recommended. So yeah, it's really important to make sure that you do it properly from the get-go. Because also, I've had a lot of practitioners that try, and you know this, Kara, they've tried and they get so frustrated with the process and they didn't even start a business yet. They're just in the beginning stages of just opening up a corp, and they get so frustrated because they opened up the wrong one, or even leads down to credentialing or something like that, that they were provided the wrong P10 or something like that. So, every single character matters when it comes to paperwork. So the hyphens, dashes, whatever you want to call it, make sure it's exactly as what you have in your paperwork.
The other thing I see, and this isn't necessarily like a fraudulent type thing or illegal or anything, but another thing I see a lot, and this is just a really basic thing, people don't even know or understand how to get a professional email. So I'll see a lot of emails come through, and let's just say your therapy business is like Sunshine Therapy. So you usually create a domain that's like Sunshine Therapy, which would probably be taken. But anyways, then it would be like Kara@sunshinetherapy.com for email. But I see some people come and they have sunshinetherapy@gmail. That's not an actual professional business email. So there's even just little things that people don't realize. With credentialing, Jessica said paying for credentialing seems to be a scam too. Steve and I might differ on this, so you can hear both sides of the stories. So we actually literally were talking about this on Monday because we did a CAQH and credentialing training. And we feel that therapists should learn, understand, and do their own credentialing versus hiring a company. A lot of the information that they need for credentialing, you have to give them anyway. So you end up giving someone and then they go and do it, and then they have to come back to you when it's really not that hard a process if you have someone that knows what they're doing teach you. So like what we do is we actually teach the therapist how to do like their Medicare credentialing and have like the checklist and the video so they can learn to do it, because then once they know how to do it, they can add on other staff versus having to go back and have someone else do it. And then they can eventually teach like a admin to do it. So, and when we first started our therapy business builder program way back, we did the credentialing for therapists, and we learned we were creating learned helplessness, because then they didn't know how to go in and fix things or change things or add new therapists. So that's our motto is we like to teach our therapists how to do it, and so they know and understand how to do it, so then they can keep that in-house and then like someone else to see. Did I lose Steve?
Nope, I'm
You
here.
cut
I was
out.
on mute. Sorry, I was on mute.
Okay.
No, I heard you all. So yeah, so you know me, Kara, I'm all for education and doing things yourself. It's what the program does, it's what Hello No teaches you how to do. So however, at a point where it doesn't make sense for you to do it anymore, I say you gotta hire somebody. So yes, do the first one, credential, learn the process, know what goes into it. But once you get to a point where your time is more valuable than paying a couple $100 to get credentialed, then I would much rather spend my time growing the business, spending my time doing something else than going into the process of credentialing. Because credentialing is also following up. And that's the part that always gets me. It's not the initial application. That part you can replicate. Yes, it's annoying, it's lengthy, but once it's submitted, it's done, right? However, it's not done. You have to follow up. You have to make sure, because sometimes it'll come back, something's wrong, right? And sometimes nothing's wrong, but you might still get a call from the insurance because they have extra questions, right? So to me, that is the part that I will say I'll learn it in the beginning, and I recommend learning it. But there will come a point where your time is more valuable than a couple $100 for the pain of doing the application and following up.
And the nice thing is, and you end up adding in like a VA or an admin, you can teach them how to do it and they just take care of it. So you don't have to do it either.
There you
So
go. That's the best. If you can hire somebody and then you train them to do it and then you keep it in-house without you having to do it, then that's the best recipe.
this is always a touchy topic. So you cannot rebrand away licensure laws. Some common myths that get clinicians into trouble. I'll just call it wellness. I'll be a coach, consultant instead. I won't call it OT or PT, so the rules don't apply. So, we are licensed practitioners. Licensure laws apply based on what you're doing, not what you call it. If challenged, you must be able to clearly articulate why the service is not OTPT, how it falls outside licensure scope, why supervision requirements do not apply. And we have had professionals not be able to get insurance for what they're trying to do as well. So just different things to keep in mind, because you see a lot of different things out there. So we talked about Medicare rules earlier. So again, can't opt out of Medicare at this time. We see some people think that they can just give an ABN and charge cash. That's not accurate. There's mandatory claim submission regulations that I didn't mention before. But violations can result in penalties. So just make sure you know and understand, if you're providing services to older adults, the rules and regulations and what you can and cannot do. Also, not all practice models are treated the same. So when you're asking for help, suggestions on social media, I always cringe when people just give blanketed advice, because it's going to differ, right? What a pediatric clinic needs is going to be different than what a pediatric home-based practice needs, or women's health versus, geriatrics. Steve and I have been working with a lymphedema practice with billing. It's way more complicated than it is for, say, our general older adult practice, because there are different codes and modifiers that you need to get right. And the crappy thing is, on top of that, is different states or insurances and so forth can make it different. So one state, maybe they'll cover the wrapping code, in another state they don't. So there's some trial and error. So just make sure that who you're getting advice for knows and understands what to do. Another thing we see that is out on social media a lot, and just done incorrectly, is worker classification. A lot of people are being classified or as an independent contractor when technically they should be an employee. I will tell you, going through an audit, we had to go through an audit with our state, and that was miserable. Luckily, we had everyone classified appropriately. But it's not just the IRS that can audit you. Also, like, the state can audit you to make sure that you classify your employees right. So OTAs and PTAs are technically shouldn't be independent contractors if they are working in a practice that requires supervision, because they can't be independent. Payroll and labor law mistakes. We've had some therapists lately accidentally pay someone what they would pay an independent contractor versus what they should pay an employee. And that resulted in some major financial difficulties. So once you get to the point of hiring people, really do your research the IRS has some good guides for you on figuring out who can be an independent contractor versus employer. Your state usually has resources on that as well. And just remember, states are different. So like we're in North Dakota and Minnesota, and when it comes to labor laws, you know, it's different in each state, and we have to know and understand what's going on. And we currently have, Minnesota is having a lot of different changes going on that we need to keep in mind with that. And then liability insurance, it's not always just liability insurance or general liability that you guys need. There's cyber, you know, if you guys are driving or have other staff driving, there's, you know, a variety of different insurances out there that a lot of people don't know and understand, and you want to make sure that you're protected with that. We talked a little bit about compliance and rules and regulations, you know, so making sure the OIG has a great website on, you know, different rules and regulations on compliance plan, making sure you understand, you know, kickbacks, referral incentives, supervision violations. You know, we see people doing things that are not really allowed, such as waiving co-insurances or offering free services, a variety of different things. So again, an LLC doesn't protect you from, you know, billing, clinical compliance errors. And then we talked a bit about financial loss. We had a therapist, I think this was about 2 days ago, that we came to us, and they haven't reconciled any of their claims ever, and they've been in business for quite a while. So they didn't know, as far as payment collections, what they hadn't submitted co-pays, co-insurance. So it can really create a lot of difficulties. Growing too fast can actually cause difficulties. Payroll booking, accounting errors. I see a lot of people struggle with that. Bookkeeping was literally the first thing I hired out for my business because I'm like, I don't want to mess up with any of that. Billing, that can create a lot of trouble. So just a lot of different areas you need to look into. So again, if you guys focus on compliance, create a structure, get systems in place, make sure you know and understand what you're doing, because guessing leads to more expenses down the line. And support is actually going to shorten the learning curve and save you time and money in the long run. So you want to build your business with intention as we get going. Steve, anything else you want to add on that?
Nope, all good.
Okay. So this is the roadmap that we went over on Tuesday with current private practice owners. We find that a lot of current practice owners, they have never built a solid foundation. So the nice thing about you guys that haven't started, you can start with a solid foundation, which is actually going to help you grow with a more appropriate level and help you grow and leverage upon what you have versus having to come back and fix. Now, even if you start with a solid foundation, you always have to come back and tweak and do things. We just, on Tuesday, we spent all day with our management team for Home Therapy Solutions working on our foundation, revising our standard operating procedures, looking at adjusting our automations and so forth. So you do have to revisit it, but you know, current practice owners that kind of get themselves into a mess oftentimes have to come back, fix the foundation, then add the systems, and then work to optimize their operations before they diversify revenue streams. Versus for you guys, if you focus on this roadmap, it's going to help you get there faster and build a sustainable practice and ultimately lead to less stress. You're still going to have stress. There's still going to be things that are going to happen, but it will help you do it in the right way to save you time and money in the long run. So phase one, build that foundation. Make sure you know and understand the proper business structure you need, what compliance aspect you need to have in place, and know and understand licensure rules and regulations. Then build your infrastructure, get your systems in place, start your SOPs, get those foundational policies that you need in place. Admin leverage, you might not need that until you get a little bit, we don't usually recommend getting admin help until you have so many clients. Phase 3, you're focusing on launching, protecting your revenue, learning how to use appropriate billing, CPT codes. I met with another therapist today that, hadn't ever heard of physical performance test CPT code. And there was a couple others. So you need to know and understand what CPT codes that you can use, should be using. And then as you grow, then you're going to build leverage, and then you can diversify and so forth. So if you follow that and really focus on your foundation, it's going to get you farther. It might take you a little bit longer to make sure you have the proper foundation in place, but it's going to be worth it in the long run. Steve, any thoughts on that?
Nope. You're good to go, Kara.
And then
Yeah.
these phases, I'm not going to go into depth because I just kind of covered them, but you guys will have the PowerPoint so you can come back and look through these. This just goes through like the foundation phase, phase 2, and then phase 3, 4, 5. So you guys can read through that. So overall, this is the part that a lot of people don't want to hear, but it's the part that protects you. The goal is to work harder, build smarter in the right order. So if you start with that solid foundation, know and understand why you need that foundation, get your policies, procedures, compliance plan, insurance, get your credentialing, know and understand billing, get that all in order, start seeing clients, build up your business, then learning how to, delegate when appropriate. You'll be successful in the long run. Yes, we'll send you out so you have the slides. This is, we have a private practice startup checklist you can use to guide you through what every step you need to think about. So go ahead and download the private practice checklist and start that. It will help you clarify what you need to have done before seeing clients, help identify different compliance system financial gaps, and hopefully help you avoid any costly issues in the future. And then for those of you that are interested, we do free private practice roadmap calls where we will, you meet with our team, review what you want to do, where you're at, and, give you feedback. Again, we do have a program. Our program's not right for everyone, but we do consulting or refer you to someone else that can help you depending on what area. There's lots of great coaches and mentors out there in a wide variety of areas. So we try to help therapists get connected to who they need so that they can be successful. Also, we have a lot of videos on our YouTube channel that will walk you through a lot of the different steps. If you don't know, really what you want to do, those would be some good places to start as well. Okay, questions. Any questions that you guys have for Steve and I? I'm going to read this one in the chat. A lot of large senior living companies credential their therapists for a number of different private insurances in addition to Medicare. If you're working for one of these companies, PRN, while trying to start your own business, would this restrict you from taking cash from a client in your practice if they have one of the insurances your company has credentialed you with, and with unless you become uncredentialed first without insurance. Is this a big audit risk in this scenario? Steve, you want to take that one?
Yep, let me just reread it. So a lot of large seniorism companies
Again,
credential
it's
the
good. You're
therapist.
going to have to get your business credentialed, and Steve can go into more detail, but you're going to have to get your business credentialed, and then you credential the therapist within your business. So your business can choose what insurances you want to be credentialed with. And my personal recommendation, and again, this is going to depend 100% on what your patient population is, but for many people, if you're working with older adults, getting credentialed with Medicare and then just staying out of network or cash, depending on the insurance, is a great option to start with, because you don't want to get credentialed with an insurance that doesn't pay you well. It can lead to a lot of financial struggles, a lot of pediatric, women's health, populations different than 65. They'll do out of network or cash initially. And then as you get going, you'll eventually learn like what insurances are the ones you should be credentialed with and what insurances you don't. And then you can add that on. But again, it's really going to vary, but your business is going to be credentialed and you decide what you need to get credentialed on with that. Steve, anything you want to add on that?
Yeah, also it says taking cash from a client. Make sure you know the also regulations on taking cash from certain clients with insurances. So just kind of that stood out as well.
Yeah, if you guys do private pay or cash, again, you have to have a GFE in place, proper consent forms and things like that. Just 1 second. Sorry, everyone's home today. Okay, we had another question. Are there any past webinars about running groups for schools and within the community? This webinar had made me realize I might need to better protect myself. I was hoping to work in the community before jumping into one-on-one therapy sessions. So what kind of groups were you thinking? One of our coaches, one of our business coaches in our program, her business, she did a lot of groups in schools and in the home. I could always connect you with her. Depending on what you want to do, there's a nature-based therapist that does a lot of groups and things in the community. That would be a great resource for you. We do groups, so it just kind of depends on what you're looking for. Let me know if you have any more detail on that. Handwriting exercise. If you want to email me, I can connect you with Alicia, our pediatric coach, and because you're thinking pediatric groups, I'm thinking, she can give you some guidance there, for sure. Other questions that you guys have. We don't want to scare you in starting a private practice, because 100% feel that if you want to start a private practice, you're willing to put the time and effort in it, it's 100% worth it. And we need more and more therapists in private practice, because when we can work in private practice, I feel it helps not only yourself, but we're able to provide awesome positions for other therapy professionals, and we're able to provide amazing care for our clients. So we need more and more therapists to do this. So again, it does take time and effort, but if you do it right away, it's going to make everything so much easier than trying. I had no idea what I was doing when I started my private practice. And I was very like, nope, I'm going to do it myself. I'm not going to pay anyone. And I made so many mistakes, and some were costly and some were bad. So the more we can help people do it right from the start, we're actually able to save them so much in the long run. So as far as processes for auditing charts, so Melanie, she actually works with HelloNote. She does a lot of training for therapists. She was actually doing a training with me. She's a compliance expert. She does a lot of chart audits. She helps with if people get audited or have denial, she helps with that. So we actually have her come in and do chart audits with all of our staff. Initially, like with one of the newer practices that just started, I met with the owner the other day, and we went through like a bunch of different reports and notes, and so I could show him what to look for. So even just making sure you're running reports on a regular basis so you can see what your therapists are billing, looking at the time they're spending with therapists or with their clients. Do their units match? What kind of CPT codes are they billing? Like, for example, we ended up finding out that this one person's therapist were literally billing the same unit, same CPT code every session, which is not good. So I would say Melanie's a great resource, but if you don't, you can use anyone and have an outsider come in and do a chart audit that knows what they're doing. We also have some example templates of chart audits that you can use and go through and do a chart audit for your own staff. So hopefully one of those things would help. How different would the process be when working with regional centers or early intervention? Just email me, Heidi, and we'll connect you with Melanie. She responds, even though she's in Costa Rica right now, she'll respond quickly. As far as the process with working with regional centers or early intervention, we have pediatric practice owners that have their own practice, and they contract with regional centers. They contract with preschools, they contract with schools, daycares, a variety of other things. So that could be something where you have your own practice and then you contract with some of these other agencies. I don't know, Chelsea, if that's kind of what you're thinking, but that could be an option. Great questions. Any other questions that you guys have? Awesome. Thank you for sharing that. Let's see. For some reason there, Paulette said that that's the most common scenario with regional centers in California. Yeah, one of our, it's kind of interesting how things shift. One of our therapists that we work with for quite a while, her focus has been on older adults, and she's had her practice for a couple businesses or a couple years, and she actually just signed a contract to provide services to the school system in her area. How long will the replay of this webinar be available? It should be available tomorrow or the day after, just depending on our VA staff and when they're able to get to it. So we'll try to get it out as soon as possible. Daniel, does the cognitive billing code that includes interpretation, is it underutilized by OTs? The cognitive performance test, the 1 hour one, is that the one that you're talking about? If so, we find that a lot of therapists don't know it even exists and aren't utilizing it. We utilize it in our practice. Yeah, so it's 1 hour and it includes the documentation time and interpretation time and all of that. So yeah, it's a great one for those that have dementia-based practices. So you're welcome. So yeah, so if you guys, again, reach out if you have questions, feel free to email us. We can connect you with other people. If you want to do, a roadmap call where we sit down, talk about what you want to do and no, I don't think that physical performance test does, Heidi. I need to double check that, but I don't think it does. And make sure you never build a physical performance test with an evaluation code or a reeval code. But if you're interested in a free discovery call, you can just scan that and we just sit down, talk about what you want to do, what options there are, and again, provide you with some ideas that might help in your practice. So feel free to scan that. And then remember, we have that private practice startup checklist to scan and run your way through. If you already have a practice, make sure you watch the webinar we did on Tuesday. Okay, any last minute questions that you guys have? Steve, any last minute things you want to add?
No, this was great. And again, this webinar is meant to encourage you, not scare you off from running a practice. We just want you to do it the right way so you don't have to pay for it later.
Yeah, Heidi, Kylie, can you send Heidi, I think we have Heidi's email. Can you send Heidi the link for Tuesday's webinar?
Yep, I will.
Awesome. Well, happy holidays. And you guys have a great night and reach out if you have any additional questions. Otherwise, check our YouTube channel, lots of different resources there. If you're looking for an EMR, again, make sure you check out Hello Note, do a free demo and so forth. So you guys have a great night and we'll talk soon.
Thanks, Kara. Happy
Yep.
holidays, everyone.
Kylie, Allison, and Paulette would like that link too for Tuesday's call. So, okay, thanks guys.